Okay. This is more like doctor appointment, basically keeping up with yourself, making sure that you are okay. Um, First thing I want to say is keep up with your appointment. Make your doctor's appointment, keep up with them, go to them, and when you're at your appointment, never be embarrassed to tell your doctor something that's going on with you. I mean, I was embarrassed to tell my doctor that I had a boil on my butt cheek. I've gotten it twice. It hurt. The first time it was under the skin. The second time it was outside of the skin. Man, that was some pain. I told him and I had to show him and I was like, oh my goodness, this is so embarrassing. But you can't be embarrassed to tell your doctor something, no matter how bad you think it is, or how silly you think it is, or it's impossible to get this at what you have, anything like that. You have to tell your doctor. Um, Keep up with the treatment. If you're doing chemo treatment, any type of IV treatment, go to your treatment. Take your medication on time and all of your medication. The reason why I want to say this is because the side effects from the medication, especially if you start off on a high dose, it really affects you bad. When I first got put on the prednisone, I think he started me off with like 60 milligrams of a steroid, and that's a lot. It's probably higher than that, but this is just me thinking off the top of my head, and he told me what to expect, so I was ready for it. And so I took it, and that night I lay down, went to sleep, woke up, crashing my leg, crashing, 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 crashing. Started crying. It was nothing that could be done because it was just a side effect of the medication. It just felt like millions of ants were just biting my skin on my leg. It was bad. My dad walked in and he looked at me. He had this sad look on his face. I knew that they didn't want to see me going through that. And the Kepra mood swings, attitude. I almost cussed out my mama. We got into it. And that's just me just telling the truth. That's the Kepra. Like I never really argue with my mom like that, or just get attitudes and just don't want to be bothered and stuff like that. And that was the Kepra. And now I'm on a higher dose. I'm already used to being back on the Kepra because after the seizures in '08, I only took the medication for about a year, got off of it, and now I'm back on it, and I felt the side effects, and I noticed the side effects. But now that I'm on a higher dose of it, my body's already used to it, so I just ignore it. Other medication side effects: loss of appetite, headache, fever. I'm anemic. I'm always cold. Uh, always. I always have on a jacket. And that's just one thing about me. I'm just always cold. I get in the car, if I'm sitting in the front seat, AC is not on me at all. Um, Another reason why I want to inform you and persuade you at the same time is about taking your medication and doing your treatment is because they had this 15-year-old on the news who needed a heart transplant. And they said that they would not put his name on the list because he did not show up for his appointment. I guess he wasn't taking his medication. Um, and I guess they looked outside of that and said he was more like a delinquent kid. I don't want to use delinquent, but that's what it summed up to. He wasn't making good grades. He wasn't going to school. Something like that. Um, the family protested on it, and his name was eventually put on the list. So that would make me want to just tell everybody, take your medication. It helps. You might not like it today, tomorrow, the next week, but it does make a difference if you're still here in about five years. Take your medication. It's important. And if you don't like it, talk to your doctor to find other alternatives. There are thousands of prescriptions out there that will help you. And when my doctor was trying to find a medication that would work for the pain and my seizure, he offered me like 7 prescriptions. And so he just put me on that gabapentin, and it helped a lot because I get pain in my arm every now and then, but it's not as bad as it was before. So I'm thankful for that. And if you feel like you go to too many appointments, try to ask the doctor if he could just see you once a month. And then that once a month, y'all, you go get a blood work before your appointment, so that way when you get to your appointment, he can tell you what's low, what's too high, what he needs to prescribe you. And if you have any questions or if you have any kind of flare up or breakdown within that month before or after the appointment, you can call his office because his staff will be available. Or he will call in a prescription for you instead of every time you get sick, you have to go to see the doctor. If you have to go see the doctor, go see the doctor. But if you just get a quick flu or something, you can call him and he'll prescribe you a prescription instead of you having to go in there, him telling you what's wrong when you already know what's wrong pretty much. So you just need him to fill out a prescription so you can go pick it up. That helps a lot too. Um, I know it's been numerous times where my doctor's office, his staff call me and tell me, okay, well, you have a vitamin D prescription at your pharmacy because your vitamin D level is low. Or you have this at the pharmacy because your blood level is out of whack. Something. And so they're real good at doing that. But that's another thing too when you're looking for a doctor is finding a doctor whose staff calls you and talks to you and tell you what needs to be done and what's wrong, or if you need to go ahead and come in for an updated appointment or something like that. Um, the exam that you go through, think of it as a small thing to a giant. I've had a spinal tap. I've had a nerve test where they stick the needle. I was probably poked 15 times. My shoulder blade, my back, my neck, my arms, both arms too. It hurt. When I got up, I just saw nothing but blood, and it was, yeah. But I held through it. I didn't cry. Tears came to my eyes, but I didn't cry. I just kept positive about it, and I moved on. Boom. Got that test done. I go to a lot of MRI. I do EKG. I've done just about enough exams for me to say that I've done a lot of exams. And it's scary to lay there and go through this tunnel in the dark and hear all this noise. It's kind of irritating too, but I live through it. I work through it. I get it done and get out and go home and wait for my result. But you have to do your exam. And when you do your exam, if you feel nervous about it, just talk to somebody about it. Talk to the doctor that's going to perform the operation on you or the exam. Get to talk to them for 5 minutes. That's all it takes. Just so that you can feel secure in their office, so that you can feel safe and feel that if anything were to happen, that you was gonna be okay either way. Um, Doing your appointment, and when I say appointment, I mean your treatment, your IV treatment, whatever type of IV treatment you have. Stay positive. Don't a weak mind make a weak body. You gotta be strong in the mind. If you're not strong in the mind, your body's gonna give up just like that. Boom. That's what I want to encourage people to realize, that you gotta stay positive. You going through it, you feeling it, I feel it too. I felt it, gone through it and back, but I'm still here. And the next thing I'm looking forward to is probably another seizure sometime soon. But I'm ready. I'm kinda looking out for myself. on where I be in case I do have a seizure. Um, so yeah, that's what I want to say about that. Just go do what you need to do so that you can avoid situations just as the young man who I said had, who they wouldn't put his name on the heart transplant list, but now his name is on the heart transplant list. He's only 15, and that it broke my heart. And another thing I want to say is insurance. Insurance companies just be dropping and adding. Not understanding. I know it's hard to get insurance. I know how it is. I had insurance at first because my mom was working, and sometimes the money ran out, and we had to pay out of pocket for my medication, the doctor's visit. Um, One thing you do want to make sure though is if you can't pay your doctor, talk to him about some other plan, some another alternative as far as paying your doctor. If you can't pay him on time or you can't pay the full amount, let him know. My doctor, he's real good. I do have a high bill with him. I do. But he called me, his staff called me and told me if I ever need anything, just to come on in and see him. He doesn't charge me all the time. He's a good doctor, and I thank God for him. I really do. And so my mom was just recently laid off, so I don't have any insurance right now, which means I have missed two chemo treatment, paying for the medication out of pocket. Be waiting for my Medicaid to come in. Um, Also, with the disability too, like I said, I had my hearing back in July 31st, and now we're just waiting on an answer. Hopefully, I get approved because I've been denied twice. I hired a lawyer with me this time, and my lawyer think it went good. So hopefully, when I open that letter, everything will be good, and I can move on. Um, so yeah, just keep driving, keep moving. The only thing that I see it as is if you don't do what you're supposed to do, nobody is gonna know how to make ways or try to help you improve you to want to do better for yourself and want better. Cause I know you hate being sick. I know you do. And I know you hate being in pain. But if you don't want to get up, take a 15-minute walk, if you don't want to take your medication, if you don't want to go to your doctor when you're scheduled to see your doctor, if you don't want to take a 30 medication, because I've been there. It's been times I stopped taking my medication. And it's been times where I probably took one dose of it because I didn't like the side effect. But eventually I said, okay, I gotta take them all. I gotta do it right. I gotta do it on time. And I try to eat. I do eat a lot. I ain't gonna lie. I do eat a lot. But when there's times where I just can't eat because it just make me feel sick. I just have no appetite at all. And so right now I'm really trying to get the weight back onto me because I lost weight. Um, yeah, that's just pretty much it. Doing your appointment, keeping up with yourself. Keep a journal entry. Every day, write down how you feel, what you did that day. So you can find out 2 months from now, like if something flares up, you can go back into your journal and say, okay, well, on this day I did that, and that would cause me to feel like this that day, and I feel like this again today. So you find out things about yourself every day. And like I said, if you have insurance, use your insurance. Even for those that don't even have a disability or an illness, I encourage everybody to go to the doctor. And I encourage everybody to get a blood work done every 3 4 months. I encourage everybody to get some type of EKG test done or MRI if something doesn't feel right. Cause you just never know. If you have insurance, use it. Cause I have no insurance right now, and it's hard. It really is. And so if you have insurance and you just not going to your dentist, your primary doctor, something, then you're just taking advantage of it. And that's what I don't like. You if you got it, use it. Use all your resources. And if you don't have insurance, apply for Medicaid. There are other websites that offer insurance, and there are people out there that can help you get insurance. Use your resources. Do your research. Understand what's going on. And like I said, just get your insurance. Somebody can give you insurance. Even if you pay $1, $2, 15, even if it's $15, and you only bring in $30 a week or $30 that month, pay your insurance. The insurance is the best thing that you can have, and you will need. Eventually, things will get better, but you always want to make sure you have insurance. Cause I know right now it's really hard for us not having insurance, but I am getting it soon with my Medicaid coming through, and yeah.